Ladies and gentlemen, to announce the laureate in the biotechnology category, please welcome Professor Marc Tessier-Lavigne.
Well, it's my great honor and my great pleasure to be able to confer the award for Best Biotechnology Product. This year, as in past years, we've had an extraordinary number of nominees who've done breathtaking work that's advanced medicine and are helping patients worldwide in so many different diseases and conditions. Before we roll out the award, I think we will be looking at the nominees in this category. I'd like to have us take a minute to celebrate all of the nominees.
In the Best Biotechnology Product category, the nominees are Amgen for Imdeltra, Arcutis Biotherapeutics for Xarive, AstraZeneca and Sanofi for Beyfortus, Bavarian Nordic for Vimkunya, Catalyst Pharmaceuticals for Agamree, Gilead Sciences for Sunlenca, Johnson & Johnson for Talvey, Johnson & Johnson for Tecvayli, Johnson & Johnson and Legend Biotech for Carvykti, Merck & Co. for Capvaxive, MGI Tech for DNB-Seq T20, Novartis for Scemblix, Pfizer and Astellas Pharma for Padcev, Pfizer for Abrysvo, Regeneron and Sanofi for Dupixent.
So it's my honor to announce that in the category of Best Biotechnology Product, the 2025 Prix Galien USA Award goes to Regeneron and Sanofi for Dupixent.
Ladies and gentlemen, please welcome to the stage the ambassador of Regeneron and Sanofi.
Are we allowed to bring up some of our colleagues from Regeneron and Sanofi to join me on stage? Come on up, guys. Well, they're coming up. I have to say, first of all, thank you so much for this incredible recognition. But I think this is much more than just a recognition for Dupixent and this great collaboration between Regeneron and Sanofi. I think all of you out there in this industry who work so tirelessly to fight back against the bully of disease should view it as a tribute to everything that you do, because I think Dupixent as a story was this incredible example for our industry of what we all do and what it really takes over so many years to really deliver a medicine that does fight back against disease. This is a story that's more than 40 years in the making. It starts probably with Bill Paul, the discoverer of the target for Dupixent in academia. It involves countless scientists in the labs working for years to prove and develop the drug. It involves countless people working clinically within the companies, but also collaborating with the many pioneering clinicians in the real world, in the field, trying to deliver to the patients, to all the patients who contribute to and risk for the opportunity to participate in the clinical trials. It's an incredible ecosystem that we're all a part of, and this is a great example of I think what this industry can really do and can deliver. Dupixent is an incredible contribution. For many of us on this stage, we actually have our own children are taking this medicine. This is, you heard from Michael J. Fox, we fight back against the bully disease, and sometimes when you see it actually affect your own child, you appreciate how we have that power, and we have to all work together to do it. And like I said, it doesn't just take one company. This was an incredible, incredible collaboration between so many people and two great companies, Regeneron and Sanofi. What I can tell you, I don't know if there's a conflict of interest here, but many of the people in this room, including who are on the Prix Galien committee in various stages, contributor actually saved this story and this drug, from Elias Zerhouni and John Reed at Sanofi when they were our partners there, to Mark Tessier-Levine. And this is maybe how I'll end it, with just an example of how you got to be very careful trying to make decisions based on commercial projections and the money and things like that. Long before Dupixent was actually approved and launched, and it was just a possibility, and we had another potential big drug, some people were trying to position it to say, well, this drug will be bigger than this drug, so why don't we trade this drug for that drug? And there were a lot of people at the company, at our company, who were willing to trade Dupixent for the other drug. And Mark Tessier-Levine said, wait a second, I wouldn't be so quick. I mean, this drug might actually treat some of the biggest allergic conditions on the planet. I wouldn't be so quick to trade it for anything. And so many on the stage, so many at two companies, so many throughout the ecosystem, whether it be in academia or in the clinical fields, and so many of you helped to make something happen that took a long time, but we think it's all worth it. So we very much appreciate it, and thank you.